Okay, they said we're ready. Let's roll. 8 o'clock on the dot. You all get extra credit for being here on time. Good morning and welcome to the 2024 annual meeting for the Alcohol, Drug, and Mental Health Board of Franklin County. I'm Donna Zeiderweg, and it is really, truly my honor to serve as chair for the Adam H. Board of Trustees. Adam H's role is to plan, fund, and evaluate community-based, recovery-oriented mental health and addiction services for Franklin County residents. But it's all of you gathered here today, providers and community partners alike, that make this vision for accessible, affordable, and quality behavioral health care a reality. So we thank you. We thank you for your leadership, for your collaboration, and commitment to better outcomes for the residents of Franklin County. I'd also like to express my gratitude to my colleagues on the Board of Trustees for their guidance and service. And if I could ask them please to stand. They're mostly here. Yes. We have others. Thank you. Wonderful. Adam H. cannot do its work without the ongoing support of our public officials, and we have, I know, a number of them joining us as the morning continues, so we thank them very much. We'd also like to thank a couple of our partners. Franklin County Children's Services is here. We really appreciate, and also Columbus Public Health. So we have lots of great partners, lots of appreciation for the elected officials and the partners that we have in Franklin County, and we thank you all for your dedication and support. With the steadfast support and dedication from providers and community partners, Adam H. made substantial strides in 2023, strengthening a continuum of care to meet the community's ever-changing needs and for mental health and addiction services. This continuum of care is made possible through the generosity of Franklin County taxpayers who fund nearly 3/4 of the Adam H. budget with a single property tax levy. In 2023, Adam H. invested more than $100 million on community services. Enhancements to crisis service continued to be a high priority and included significant progress in the construction of Franklin County Crisis Care Center, which will open to the community this spring and frankly will be a game changer for this community. Other Adam H. funded services are in the areas of prevention, treatment, recovery supports, housing, and family supports. These services, delivered through the Adam H. network of more than 30 caring providers, reach more than 95,000 individuals across our community, providing help, healing, health, and hope. We recognize that a key component of that journey to health and healing is building resilience, developing and strengthening the skills that help us all cope with and manage through life's challenges. Perhaps no better example of resilience is the path that many in our veteran community walk. With us today to share his story is Eric Sowers, a U.S. Army veteran who served in Afghanistan. Eric recently earned his master's degree in social work and is currently pursuing his PhD through The Ohio State University College of Social Work. Eric has worked in the Veterans Treatment Court arena for over 6 years. There, he learned that veterans are disproportionately represented in the criminal justice system. Because of this, he's researching the criminal justice system's veteran population and how to address recidivism rates. Much of his recent work has incorporated whole health and resilience applications to provide combat veterans with long-term means to overcome challenges through Brazilian Jiu-Jitsu and fitness training. Ultimately, his research aims to positively impact veterans' transition into civilian life, helping them remain in good legal standing, empowering them to become leaders within their communities, and preserving their dignity. Please join me in welcoming Eric Sowers to the stage.
Good morning, everybody. Can you hear me all right? All right. Just just want to say thank you. I really appreciate the invite to come up here and share a couple words with you about my lived experiences as a veteran. But without further ado, also we got to update that I'm a newly minted PhD candidate. So I passed the candidacy exam. Thank you. So my name is Eric Sowers, and I'm a PhD candidate, 2024 Tillman Scholar, but I'm also a Global War on Terror veteran, a former paratrooper, and someone who wants to defy the odds by any means necessary. I've lost parts of myself in combat, and I've watched too many come home only to fall, casualties of unaddressed and unprocessed trauma, and a system that failed them. I know firsthand what it means to carry that weight long after the war ends. I spent nearly a decade acquiring a legal education on the wrong side of the law, battling a system that often forgets the humanity in those it entraps. But I've taken responsibility for my actions, but I also refuse to let those hardships define me. Malcolm X once said, "Education is the passport to the future, for tomorrow belongs to those that prepare for it today." I'm preparing for that future through education and advocacy, not for vengeance, but justice. Justice for myself, those I've lost, and all who walk this path in silence. We all fail at who we're supposed to be, but the measure of how well we succeed at being who we are, that's the legacy that will stand the test of time. I will rise in this life or the next, not just for me, but for all of us seeking dignity, justice, and the future we deserve. Thank you. Cinderella?
I appreciate it. Shelley says when something weird happens, that's a good omen. So here it is. I'm about to bring the fire. Not really. Good morning. And Eric, thank you so much, not only for being here, but for the work that you're doing. We're so grateful for the path that you've chosen and to work in behavioral health and make a difference. So thank you very much. So recognizing that veterans are a population at risk for mental health and addiction-related challenges, Adam H. of Franklin County recently launched a new area of outreach. Now, it's my pleasure, after you've heard from Eric and his emphasis on the veteran population, it's my pleasure to reintroduce someone that many of you may already know. But Mr. John Logan is now Adam H's first Military and Veterans Engagement Coordinator. John, will you please stand? Thank you. John Logan serves as our point person and subject matter expert on supporting military and veteran residents and their family, and we couldn't be more grateful that he's always been in this role, frankly. He's worn many hats in our agency, but to have him now dedicate his service to our board in this way is so powerful and so needed, as you've heard from Eric as well. So thank you again, John. So as I prepare for our speaker, I just want to reorient us and those of you that came out this morning, and we're really grateful, not just for your attention this morning, but for the work that you do every day and the lives that you touch. As a board, Adam H is obligated to focus on the community solutions that promote healthier outcomes for all of our residents. That's our obligation. It's written in Ohio Revised Code. Data is critical to informing our investments. As sobering as some of this information that I'm about to present may be, this knowledge is fuel for all of us as we continue to address the ever-evolving mental health and addiction needs in our entire community. This data also helps to underscore the importance of ensuring that people in our community get and remain connected to services as quickly and easily and early as possible. This is but one driver of our focus to strengthen the crisis care continuum, to meet people where they are, and give them the help that they deserve and require along their entire life course journey. So, over the last several years, there have been thoughtful, purposeful enhancements to crisis services, thanks to the work of many in this room. In Franklin County, there is always someone to call with the launch of 988 as the National Suicide and Crisis Lifeline, operated locally by North Central Mental Health. Hello, Joe. Good morning. And his team, as well as our team at NetCare Access, who does text and chat services through 988. Also, through a pilot with NetCare, there is now someone to come through mobile response teams comprised of both peers and clinicians. We'd also like to acknowledge that Nationwide Children's Hospital is also in this space and does mobile crisis response services for youth and adolescents. With the opening of the Franklin County Crisis Care Center this spring, there will be an additional place to go in our community. While AdamH and partners work to enhance the collection of crisis services and better connect those in need, every community's goal should be to decrease the likelihood of a crisis ever occurring and to prevent poor outcomes should a crisis emerge. It is with that backdrop, I'll now present some other information. Nearly 25% of the AdamH annual budget supports prevention services. These are programs and provider services focused on promoting better mental health and preventing or delaying the onset of mental health challenges and substance use disorders. In 2023, our investment was $23 million. Yet as we look at the data, we know there is more that needs to be done. Recent data indicates that prevalence of mental illness throughout Ohio and there's an increased prevalence of mental illness throughout Ohio, and that trend is happening locally in Franklin County. The latest data released by the National Survey on Drug Use and Health shows that approximately 8.7% of Franklin County adults aged 18 and older have a substance use disorder. And of these, 86% reported they did not receive treatment. 22% of Franklin County adults report that they have a mental illness, and roughly 82% of those individuals did not receive services. Cost was the biggest barrier to treatment for both mental health and substance use disorders. This not only reflects the realities of individuals not having insurance, but also having insurance that does not adequately cover behavioral health care services. So we have more work to do. And young adults are experiencing mental illness and challenges with substance use at higher rates than their older counterparts. Our data team estimates that an upward trend for these statistics will continue as newer data is released. Shifting to alcohol use disorder. The long-term data trends on this subject are also sobering. Ohio and Franklin County alcohol-induced deaths are trending upward, which also is reflective of national trends. Franklin County's rate of alcohol use disorder is higher than the state's, according to the Ohio Department of Health. And there's been a substantial increase, as several of you might imagine, living through our last 5 years. There's been a substantial increase from 2018 to the present. According to a study done this past spring by the Center for Disease Control and Prevention, across the U.S., deaths tied to excessive alcohol use rose 29% in just 5 years. We have a challenge. Something that seemed old is still very real, very present, and emerging here, not just in our community, but across the country. More people are dying from alcohol-related causes, such as motor vehicle crashes, alcohol poisoning, cancer, and cirrhosis of the liver. Now, to deaths of despair. Related to suicides, Franklin County's suicide rate of 12.4 deaths per 100,000 people is lower than the state's rate of 15.2. and has remained relatively unchanged for the last 5 years. Franklin County is also below the federal Healthy People 2030 goal of 12 deaths per 12.8 deaths per 100,000 persons, established by the U.S. Department of Health and Human Services. This flat county rate, however, masks even more concerning trends within our resident populations. These deaths of despair are increasing among teens, older adults, and Black non-Hispanic males. So despite our flat rate, we have tough challenges to solve. Regarding overdose deaths in Franklin County are down slightly from a peak in 2020, but they remain higher than that of the state rate of 45.6 deaths per 1,000 people. This reduction represents the significant work led through the Columbus and Franklin County Addiction Plan and its partners, and we are grateful for the change in this trajectory. In context, however, this slight reversal is of a deadly trend that quadrupled from 2014 to 2020. So we want to continue to turn the curve. All engaged partners are working to continue this decline. And I should add a note that I have been recently made aware that there are jurisdictions that are now de-emphasizing efforts to combat overdose deaths because they don't think it's a problem anymore, because they are seeing a downward trend. I encourage you to have them press on. We need to continue this trend of decline. And within certain populations, the overdose death rates continue to increase, and that is part of the challenge, namely among our Black and Hispanic residents. The dangers of recreational drug use have increased dramatically in recent years, driven by the increased availability of synthetic opiates that accounted for 85% of overdose deaths in Franklin County in 2022. I was struck recently by a New York Times opinion column entitled "How Fentanyl Drove a Tsunami of Death in America." You may have seen it. It just was published in the last month. It was written by Maya Salzovitz, a contributing opinion writer who covers both U.S. addiction and public policy. Her column notes that addiction is most often an attempt to escape despair. An attempt to escape despair. It's a challenge that naloxone cannot solve. And the answer is to focus on the drivers of demand, not just supply. This means addressing the roots of addiction and treating it compassionately and holistically. That's what's required of all of us. It also requires clearer insight to the factors driving longstanding mental health addiction challenges, as well as resiliency, and a deeper understanding of the social determinants contributing to higher rates and poorer outcomes among certain populations. It is why we are honored today, not only to do this work and stand shoulder to shoulder with you, but to have Dr. Scott Langenecker here with us this morning to update this ADAMH network, our providers, our community partners about the State of Ohio Adversity and Resilience Study. I offered this venue, our annual meeting, to Dr. Langenecker several months ago to increase local awareness of this very important work and to help figure out how all of us can be a resource. The pioneering research that Dr. Langenecker will discuss will focus on families across generations with the intention of following their course of wellness over time. SOAR takes on the challenge to understand the causes and complexities of mental illness and addiction. Franklin County ADAMH is fortunate to be in relationship with The Ohio State University as they chart new ground to understand why and how and what we can do to intervene to prevent poor outcomes across populations. I want you to be inspired by what you will hear and what you will learn, and I want you to go out and inspire others. And we will be standing shoulder to shoulder with you as we join in this effort. Ladies and gentlemen, Dr. Scott Langenecker. Oh, wait. I'm sorry. You come, please. I still have more to read about you. I'm sorry. I was like, oh, turn in the page. All right. Forgive that. Get back into composure here. Dr. Langenecker is a professor and vice chair of research in the Department of Psychiatry and Behavioral Health at The Ohio State University Wexner Medical Center, College of Medicine. He is a clinical neuropsychologist who specializes in assessing and treating mood and anxiety disorders focused on late adolescents and young adults. Is this uncomfortable for you as you're standing here? I'm sorry. I screwed
Turning
it up.
shades of red.
I screwed it up. Scott's research effort are focused on key life transitions where support systems and stressors may change, increasing the risk for emergence or exacerbation of brain illnesses, including suicide. He's also an active advocate for suicide prevention with 20 years of volunteerism with the American Foundation for Suicide Prevention. Scott received his PhD from Marquette University, did his internship at the Albert Einstein College of Medicine, and completed his postdoctoral fellowship at the university that shall not be named way up north. That's okay. Y'all know what I'm talking about. Please join me in welcoming Dr. Scott Langenecker. He's already here to the stage.
Thank you.
So much.
Thank you and good morning. So I hope to share with you a little bit of the enthusiasm that I have for this initiative. But first I want to be grateful for this opportunity. So this actually marks a success in all of the work that you have all done. And you might say, what are you talking about? This commitment, the commitment by the state of Ohio for the SOAR study is actually an outcome of the hard work that you do. And what I mean by that is that we have learned through the hard work that you have done for time and time again that addiction and mental health challenges are not a foregone conclusion. So as Eric was talking about, people are plastic. We live in communities where we can learn and grow and change. And health and wellness is actually something that we can drive towards and attain. So I come today as a messenger of partnership and hope. And actually to congratulate you all because you have started to change the narrative around mental health and addiction stigma. That's the only reason why I'm here. If that hadn't changed through your hard work, I wouldn't be standing here. And I've been waiting for this moment for 25 years. So believe it or not. So, I gotta find my notes here. Here we go. I got it. All right. So we start out with the bad news, which is what we don't know. Why do some folks actually fall down? And I would put to you that we all fall down at different moments in our lives, and actually mental health challenges are the norm rather than the exception. But that doesn't mean that we are destined to be what yesterday was. Tomorrow is a new day. Today is a new day. And so when we think about adversity and trauma, we acknowledge and we accept that these are real things. And we don't brush them under the rug and say, oh, just rub some dirt on it, if we're talking about football analogies. We acknowledge and we accept that these challenges are real and that people do struggle. And that struggle of being a human sometimes is hard. But we also embrace the idea that we have incredible capabilities as human beings to adapt, evolve, and demonstrate resilience. And that is the essence of why I'm here talking to you today, is how do we find new pathways to resilience, and how do we strengthen the existing pathways that you work with people every day to build and to move toward. So there is a biology to this. There's this really expensive piece of equipment sitting on top of my shoulders that sometimes works appropriately and sometimes messes up. But our brains actually are the drivers of mental health challenges and addiction challenges that we have. But our brains do not live in isolation, right? We as humans are actually social creatures. We live in communities, we live in families, we live in work networks and social networks. And that is part of what we want to understand with SOAR is what is the who, the why, and the how of mental health and addictions challenges so that we can provide information for you all on how to bend the curve. I was just recently celebrating my 30th anniversary because I'm very lucky that I have a very tolerant and loving spouse in the Virgin Islands. And I'm going to share an analogy with you. In the Virgin Islands, there was privateering and piracy for a good chunk of time, and I got to do some snorkeling and see one old ship's anchor. And you might say, well, how does the SOAR study fit into what ADAMH does? And the analogy I'd like to put out to you is that we are the people who are up in the crow's nest with our periscope, looking, the spotter's glass, they didn't have a periscope then, looking off to the future to try and understand where the treasure is. And the treasure in this analogy is actually these new pathways to resilience. We are not changing or directing anything that you are all doing. And in fact, my role here is actually to start the discussion about partnership. How can we be good partners, and how can you teach us what is successful you're doing every day, and how can we listen, and how can we learn? So you've heard the numbers from Erica Clark-Jones, and I would put to you that one way to look at this is to say that Ohio is at the center of a national epidemic of deaths of despair. I would also say to you that Ohio is at the center of a pivotal opportunity to bend the curve for these deaths of despair. And I, as an eternal optimist, would like to choose that second storyline because I think we have all we need to actually move forward to bend those curves. So when we think about what we need to know better, we actually need to listen and learn from the people that you work with every day and from all of you. What are those pathways to resilience and health? And when I say resilience, I don't mean what is portrayed in the media often, which is somebody winning a marathon or somebody, spiking the football after they scored a touchdown. Sometimes resilience is actually getting the kids off to school in the morning. Sometimes resilience is being able to show up for work and feeling like you've contributed in a meaningful way. Sometimes resilience is finding housing. So when we talk about resilience, I want to embrace a broad definition of today can be better than yesterday was. There's a really pivotal quote from Archbishop Desmond Tutu, who won the Nobel Peace Prize. He was referring to war and refugee crises, but the quote holds true for what we're talking about. There comes a point when we must stop just pulling people out of the river, and we need to go upstream and find out why they're falling in. And of course, then the analogy holds that we might put in life preservers, guardrails, and other things that help people to stay well. This is our river, if you think about it, and you all know the things that I'm going to put on this slide. Suicide and overdose are challenges, and those numbers are a little bit better for overdose this year, but suicide is continuing to go in the wrong direction. And as Erica pointed out, the overdose numbers compared to a decade ago are actually really high and disturbing. But when we think about the causes and risk factors, I want to point out, sorry, I don't know if my pointer is going to go that far, maybe it won't, but the causes and risk factors, what we're interested in thinking about is what are the modifiable factors? What are the things that people can actually change? Because when we're talking about mental health and addictions, the language of stigma is this is what I'm supposed to be, this is what I'm destined to be, and I'm stuck. And you work with people every day and you try and change that language to say, how can things be different today and tomorrow? How can we actually develop support and resilience? So when we think about causes and risk factors, we're not sort of saying, well, you've been dealt a bad hand and you need to accept it. We're talking about actually how can things get better, and what are the things that we can do and learn to help move towards that. This is the point where we kind of cheer for Ohio. This is the first study of its type where we have a governor and a legislature and our AdMH boards, thank you, who are moving towards this idea that illness does not live solely within a person. Illness is a part of a system that includes biological, psychological, and social factors. And I know that you all know people who are actually resilient, maybe in part because of their own actions, but also in part because of the systems that they're embedded in. You know, a loving parent, a caring spouse, a supportive boss or supervisor at work, a great therapist. There are different pieces that come into what might be resilience that's not just embedded within a person. And we should embrace, accept, and elevate that as a storyline, is that we do not stand alone, we stand together. So this is the genesis, and for those of you who have not heard of the Framingham Heart Study, you have heard of cholesterol, right? You haven't heard of blood pressure. We have knowledge today because of 75 years of scientific learning from the Framingham Heart Study about what are the drivers of cardiovascular illness. That's what we hope for from SOAR, is that SOAR can actually help us to take that 12.8 number that Eric was talking about for suicide and say, well, actually, that number could be 6, right? That number could be 8. What are the things that we can actually do to move those numbers lower? And if I could be so bold, what are the things we could do to sort of say about addiction? Let's go to the days when we were pre-synthetic, right? The numbers of pre-synthetic, and I think we can. And so, you know, learning what are the factors that drive towards these illnesses and poor outcomes, then helps to highlight some of these modifiable risk factors that people can then learn about, and I'll talk about that later as one of the barriers that we hope to address. So it's a family-based study, acknowledging that how people define their family, their source of support. I'm not talking about biological family. I'm talking about, perhaps for lots of people, the family that they build around them. The idea that we're looking at things that are multi-generational. There is an intergenerational transmission of mental health and addictions challenges, and that has driven the narrative around stigma. And that's why I stand here today, is that people are rejecting that narrative that you have to be the same thing that happened to your parents, that you have to be the same part of the system where you grew up. And so the multi-generational longitudinal pathways that we're studying, with a large enough sample of Ohioans, that we can actually understand unique predictive pathways with modifiable factors, then gives you all the information that you can work with to develop new treatments, to build on the amazing treatments that you're already doing. So this is our partners. And when we first started talking about SOAR, it was like bringing science to the people. And it was like, actually, no, that's not the language that I'd prefer to use. I like to talk about science from, for, and with the families of Ohio, because actually, this is a partnership, right? I have technical skills as a scientist that I can bring to bear, and I have clinical skills as a psychologist that I can bring to bear, but I cannot conjure up these stories. I cannot conjure up the biological, familial information that's actually going to help us to understand pathways to resilience. So it's a partnership. As part of this partnership, we are acknowledging that Ohio is a big state. Ohio has lots of geography and diversity to it, and that's amazing. But also, there's lots of folks in Ohio, in our rural areas and in our inner cities, who feel left out and left behind. And you all know that in some ways they're right. They have been left out and left behind. So SOAR is an acknowledgement, and humble acknowledgement, that even though we have been doing our best, we need to do more, and we can do more. So this is a mobile MRI scanner that's going to different rural sites around the state. In addition to that, as I mentioned just a moment ago, we have 2 sites in Columbus, Nationwide Children's Hospital and Ohio State University. And when I come to the point where I ask you for your support and help later, we'll talk about how families can become involved in the studies. All right, so why Ohio? Well, Ohio has a long history of leading, and I think it would be appropriate to think about how Ohio can be a leader in changing the narrative around mental health and bending the curve towards resilience and wellness. Anything that we learn in Ohio because of our geographic, social, economic, racial, and ethnic diversity can then be translated into other places within our country. A big part, and this is actually the part where I apologize, a big part of this initiative came, I think, from a clever conversation that a data analyst had with the governor during COVID, because the governor was getting weekly reports about COVID deaths. And somebody probably snuck in the suicide and overdose deaths into the COVID report. And the governor perked up and said, our people are actually struggling quite a bit in Ohio. And the apology that I'm giving to you now is that the legislative process that brought us SOAR is not the process that we would have actually liked to develop in the emergence of SOAR. Most of the time we start out with coalition building, right? I'm here today, actually 9 months after we started, to start with a coalition building with AdamH, right? So I'm kind of cart before the horse, or maybe even horse outside the barn apology at this point. Hopefully you'll forgive that, because that was a function of the legislative process, not a function of our interests and wishes. So we do have an active interest, willingness, and drive to partner with you all. So anyone who wants to have our dog and pony show come to you, and more importantly, anyone who wants to teach us what we should be paying attention to and why we should be paying attention to certain things, please do reach out, because we need you. And when we think about what SOAR is intended to do, it's not designed to do something new. It's designed to build off of the bedrock of what you're all doing already and add, right? We're not replacing, we're not directing, we're trying to build and expand. And so these are the different sort of things that we're hoping to do in our engagement process, and we are grateful for and desperately asking for support in rolling out these initiatives. So please do engage with us. We'd be very grateful for that. And that's actually another ask that I'll have towards the end of my presentation. You'll see at the bottom that there's a community advisory board. We are missing is always a strange word to use, but missing is the right word here. We are missing diversity in our community advisory board. And so I ask you to give us suggestions, because inclusivity and diversity is about representation. and we have lots of scientists. We do not have community activists. We do not have as many people of color as we need and would like. And so I will ask for support and assistance there later. So how does this actually work? What is the process of what SOAR is intending to do? So we have a big wellness discovery survey. Folks from all 88 counties in Ohio are participating. It's kind of like a broad 1 hour survey. I've actually got some postcards that you can take and hand out to folks if you want. You can take a postcard for yourself to fill out. And that gives us sort of a sense of what are the drivers of adversity that people are experiencing, what are the mental health challenges that people are experiencing, what does family and community support look like, and then what are their what are the known resilience capabilities that people have. And of course, there are unknown resilience capabilities that we expect to have out there that we'll learn. There's also a brain health study. The brain health study includes brain imaging. It includes EEG, which is electrodes on your head to see how people respond to certain types of stressors, how they can navigate prior traumas, questionnaires, interviews, blood tests, and the goal is to do just like Framingham, to use that information to try and understand what are some of the potentially modifiable risk factors for mental health and addiction. And then there's a loop. There's a loop that actually brings us back here, hopefully in a year, maybe in 2 years, where we come back and we start talking about some of the data. And you start saying, hey, Scott, that doesn't make any sense, or that's absolutely right, do more of that, so that we actually have a dialogue and a conversation about what some of these modifiable risk factors are and how we can actually convey that information to the people that we work with every day so that they can see that in those moments of despair that there is actually possibility and there is hope. And then we move that into pilot intervention studies, trying new things and see how they work. We expand our workforce. You already have an initiative for that. We think about what wellness looks like in our workforce and how we retain people so that we can actually deliver good quality services. So this is just a few of our partners so far. We want to add your picture up here as well. All right, and these are some of the things that we're actually rolling out. So we've hired a SOAR support navigator, and that person, when we're meeting with these families and we identify that they have unmet needs for care, our support navigators are going to actually help them to connect with your agencies or appropriate services. We already have a system in place for when we interact with folks who are in crisis, how to provide support from them. And then we also just got our participant experience survey rolled out, and that is, again, part of that virtuous cycle of learning, which has evolved, right? It used to be, even 10 years ago, I, as a scientist, would ask you questions, you would answer the questions, and then I would come to my astute conclusions about what was wrong with you and what you needed to do next. It's a much more dynamic process now. I share information with you and you say to me, no, that's not right, Scott, or that actually is really helpful, do more of that. And so in communicating with service providers like yourselves, but also with patients and families, it's moving towards more of a dynamic exchange of information. And that is a really powerful process, because when people start to feel ownership of what SOAR can be, then they start talking about it with their legislators, with their community leaders, and then we can grow this. And it actually comes back to, in your report, and actually what Erica Clark-Jones was talking about, some of the care gaps, right? Those care gaps actually move when people feel empowered to advocate for themselves, right? You all know this. I've been in this business for 25 years. The single biggest challenge we actually have is that most of our folks that we work with don't believe that they deserve a better tomorrow. They don't believe that they deserve a better tomorrow, because when they get to that point where they know that I deserve better, they will advocate. And there's lots of people who could then advocate. And then the voices rise and we will not be denied. So let me give you a little bit of results. It can be long-winded. Hopefully this is interesting for you all. We've had tremendous, and I mean tremendous response. We started this survey 9 months ago, and we have 70 to 100% of target responses across the state. Franklin and Delaware counties are amongst our top responders. You can see, it's hard to tell, but they're near 90%. And actually, you'll note that we actually have over 100% response in Southeast Appalachia. So the message of SOAR, when people see, I should have brought it up, when people see, I'm going to jump down and grab it. It's okay. When people see this postcard in the mail, so these postcards are sent out to 300,000 Ohioans across the state, it just sort of says, hey, help your neighbors in your county and receive a $50 gift card. And in the back, it talks about what SOAR is and what the Wellness Discovery Survey is. People are seeing that, and they're actually encouraged that people are actually listening and trying to understand some of the challenges that they're facing. And we got great response across age ranges. We actually have great responses from all of our traditionally underserved groups. So people of color, people in rural spaces are responding in numbers consistent with our census numbers of 2020. So we're getting people to speak up. This graph is going to take me a minute to walk through with you, but I think it's actually a really helpful graph to sort of think about how Ohio has changed over the last couple decades and where some of our opportunities and challenges lie. So I want you to focus on the blue bars first, or I guess light blue bars. Those are folks who live within 50 miles of where they lived when they were 10 years old. So on the one hand, you could sort of look at that and say, well, that means that they're actually really satisfied with the community that they grew up in, and they're staying in that community. But those of us who have been in this business a long time also know that some of those folks actually are trapped by lack of economic and social mobility. And so there's potentially a lack of opportunities for those folks. And if you look at, Cleveland, within the city limits, Lucas County, some of our Appalachian locations, there's not as much mobility as we would like. On the flip side, the pink bars indicate the people who have come from farther than 50 miles away, and often from outside Ohio. And those are really strong markers. Those are markers that economists use all the time of growth, right? Economic growth. People come to where there's opportunity. And we'd like, if we had our way, to have those pink bars be larger for all of our regions in Ohio. There's old data, and that old data is probably something you're going to say, yeah, we know this already, Scott. There's old data showing that economic and educational opportunity are the easiest modifiable risk factors when we think about adversity to address. And by easiest, I mean we have a huge Intel plant coming just northeast of Columbus now, bringing hundreds, if not thousands, of jobs to central Ohio. That will have an impact on mental health and addiction in a positive direction. All right. This was actually a questionnaire that we added at the end about economic optimism. And of course, sometimes scientists and journalists sort of take a competing road to what's the most negative storyline we could come with. The scale was actually an economic skepticism scale, and I chose to reject that and flip the scale and talk about economic optimism. So the first thing I would say to you is that this is a scale where lower numbers are better. The scale goes from 5 to 15. And so the narrative that we have around the state that I've been hearing from many people is that people are not very optimistic about economic opportunities in Ohio. This data actually tells a different story. People are actually feeling pretty optimistic about economic opportunities in Ohio. So a score of 7, even a score of 8, towards the bottom, is still below what would be an average score. So there's optimism out there. So I'm running out of time, but I do want to come to the main points of what I wanted to share with you today, which is this is a tremendous opportunity for us all. And so you might be looking at me and saying, yes, God, it's a great opportunity for you. And I would say, no, actually, it's a tremendous opportunity for us all. Because those of us who have been in the mental health space for a long time know that about every 8 to 10 years, there's sort of this surge towards, we're actually going to treat brain illnesses the same as we treat other illnesses. And we're going to break this cabal on how insurance spreads out behavioral health from other aspects of health. This happened in 2008. It happened in the late 90s. We're at that moment again where there's a surge of enthusiasm and voice around saying, actually, we're spending a lot of money and we're not helping people get well. How about if we spend that money more wisely and help people move towards resilience? So as Eric was sharing with us beforehand, a good number of veterans who have served their country end up in the criminal justice system. Like that's a tragedy. A good number of our ethnic youth actually end up in the criminal justice system before they even get a shot at opportunities. So this is a broad message. Sorry, I got a little bit emotional there. All right. So what we learn here can be applied everywhere. And this is actually a really important message because it brings me to the last slide. Oh, nope, not the last slide. So let me tell you a little bit about the Brain Health and Discovery Study real quick. So this is a graph, a complicated graph of sort of what illness looks like. And most of the time when we interact with folks in our system, it is in the acute, active state of an illness, where care is super expensive, and where we're actually often doing triage rather than wellness building, right? So what would be a beautiful thing that could come out of this, which you might be saying, oh, we can't do that, Scott, we can't figure it out. But I would put to you that actually I can use a cholesterol test now, I can use high blood pressure now to actually talk with you about modifiable risk factors for cardiovascular illness. That didn't emerge out of nowhere. It emerged out of a number of decades of sustained study. We actually know some of the modifiable risk factors that can move people towards resilience already. You know that stuff. But there's probably stuff that we don't know yet that we can learn. And so the idea is that if we can move people into that prodromal stage where we're delivering those prevention services that Erica was talking about in a timely and effective way, we can then actually deliver wellness and resilience services in addition to providing crisis services for people who don't quite get caught early enough. But we don't want to always be doing crisis stuff, always be doing triage, right? We want to be thinking about how can we help people sooner. So you may or may not know that just 6 miles to the north and a little bit to the west of here, we in Columbus are actually helping build the next space station. You might say, well, why in the world are we showing a space station when we're talking about mental health and addiction? I was looking at a graph of inventions just the other day, a couple months ago, and there have been 5 sort of evolutions of inventions. The information age is the most recent one. Wouldn't it be amazing if Ohio was actually at the center of the 6th generation of invention? And our invention is actually additional pathways to wellness. And I would put to you that that is a little bit of a bold statement, but I want you to think about that and savor that thought for a moment, that we could lead in developing new pathways to resilience. I think we can. And I'm an eternal optimist, and I'm excited about it. And so that is the point where I actually transition to the things that I'm going to ask, which I left over here. So I have two main asks of you all. So the most important one, and thank you, Erica, for the invitation, is a humble invitation to be a partner in this process. So today is just one day, but it's potential for the beginning of conversations. Hey, Scott, I've noticed this with the people who come through my agency, or hey, Scott, this is what I've noticed in the families who tend to do better that come from my community. Because the more that we listen and learn, the more that I listen and learn, and take off my science hat and put on my human being hat and my psychologist hat, the better we can be together, and we can have conversations about how to move this forward. So that's my first ask of you, is to be a partner in this journey. With that partnership, communication and honesty, that's all I ask. The second ask, we have, I mentioned this before, we have these fancy postcards, and there's another one that you can take with you. It's okay. I'm in to get my steps in. So this is another postcard you can take with you, and this is the moment where Jamal and Irvi and Chuck, could you stand up? So they've all got postcards if you want to grab them. There's a QR code that folks can scan. This is a study that's open to all Ohioans. So if you want to participate, you can. If you want to take some of these back to your agency and hand them out to some of the people that you serve, you can. And let me elaborate on that point. When we look at prior studies like this, there have been no studies that have looked at families and not in an intergenerational way. When we look at prior studies, we overwhelmingly study white women who are worried and well. That is not our goal here. Our goal is to study all of the people of Ohio. And there are some real challenges in doing that. And I'm hopeful that you can help us to understand some of the barriers. I'm going to talk about them in a minute. But to get true voice and participation from the families that you serve. Without that, and I mean this with all sincerity, we could take that money that was given for the study and flush it down the toilet, because it's not going to be valuable if we continue to study people who are worried, white women, and well, mostly well. There's value in those studies, trust me, but that is not going to bend the curve that we need to bend, because, as Erica illustrated, our black men, the numbers are not going in the direction that we'd like. Our elderly, the direction is not going in the way that we like. Most of our overdoses and suicides are in folks who have not been studied systematically. So I ask you for assistance in that. I alluded to it before. We are looking for an active participant or participants as consultants on our community advisory board. It is a paid position. I'm hopeful to entreat you all, to beg you all, to suggest folks from underrepresented communities, people of color, perhaps veterans, to serve on that board. Also, when we're talking about workforce retention, SOAR is an opportunity for us to speak to the next generation of healthcare workers about where we're going. And so when we talk about students in higher ed, if there are folks who want to join us, we have 2 positions open now. We're looking to have more positions. Okay, now Erica asked me to talk about barriers, and I'm going to talk about barriers. So these are things you all know well. Trust. There's a balance between trust and hope here, and I'm going to just tackle it head on. There is a real and meaningful lack of trust in what the government will do with this information. And I balance that with hope. So I don't want to sugarcoat the fact that I can't control what our leaders are going to do with the information that we collect. So our mandate, our goal is to collect the information and to report it honestly. What our leaders do with it after that is another thing. But part of that trust, an important part of that trust, is that we hope that we can, as I alluded to before, help people to start raising their voices about what their needs are, so that it's not always this, not a word you should use, often. It's not often healthcare providers who are doing most of the advocacy. We want our families to stand shoulder to shoulder with us and advocate with us. So that's part of building trust and hope. There are real barriers, transportation and time. So, families who are struggling, even families who are not struggling so much, it can be difficult to set aside time to participate in a study like SOAR. We do compensate families for participation. It's about a 6-hour commitment spread out over a couple of days for each person. It's one of the few research studies that families can do together, so it actually can be a family growth experience. They get to come to a facility, what here would be Nationwide or Ohio State. They can come with a family member and actually have kind of open discussions about mental health and addictions, which is a novelty in a healthcare setting, right? Oftentimes it's the patient only that comes and the family is left at the door. So it can be a growth experience. So about $325 for that participation. So it's a meaningful amount of money to honor people's voice and time. And then a final barrier I want to mention comes back to this idea of stigma, which is understanding. People understanding that what we don't know about resilience, what we don't know about mental health and addiction, is not something to fear. It's an opportunity. And what that means is kind of what I was alluding to before, is that we are not predestined to be not resilient. We are not predestined to be resilient. We embrace the idea that resilience is something that we can move toward and learn. And that is the point where I thank you all and hope that there's some questions. Thank you. Yeah, go ahead.
How long is your study open?
The study, the data gathering happening now will be going through the end of June of 2025. But the goal is to have the study go for decades and for generations, so that we not only can see the pathways towards illness and resilience that are in place now, but as we move towards these new interventions or even evaluate existing interventions, we can better understand these modifiable risk factors. Thanks. Yeah.
If you had to give a definition to the word resilience, how would you define it? Because I just hear a lot of different definitions. Yeah. So I'm interested to hear from you.
So, yes, an analogy. We are not rock. We are clay. We are moldable, right? We are not stone. We are bamboo. So the simplest definition is all of us at some point in our lives will fall down. Resilience is about how do you get back up? And it doesn't mean you have to do so gracefully. It doesn't mean you have to do so on your own. It just means how do you get back up again? And so I use a very broad definition of resilience. Does that help? Yeah.
So you spoke, and I could have missed it, but you spoke about wanting to engage the community and have more representation in the study, which is exactly, oh, thank you, which is exactly what is needed. I appreciate that. What I am a little concerned about, though, is the institutions. Oftentimes, Nationwide is considered an institution, and so is, of course, The Ohio State is an institution. So if we are wanting to engage the community, I'd love to have dialogue really about how do we connect to the community. People aren't coming to you to tell you their story. They will come to you if you're in their community in a place of trust.
Yes. Thank you for saying that. 100%. How can we do that in a way that feels collaborative and honest and not, I'll use the word, extractive, right? Or worse. Because I don't, like I said, I don't want to pursue this study if we're not doing it for all of Ohioans. To me, that would be a tragedy. Hopefully that helps answer your question. Yeah. Oh, over here.
Hello, my name is Stephanie Starks, and I am the CEO and Clinical Director of Starks Counseling. I'm also a member of the National Association of Social Workers. I have a small private practice. I work mostly with people who have experienced some level of trauma. So my question to you is, are you guys going to put forth a concerted effort to work with small private practices? Because I saw a lot of large organizations and institutions, but a lot of this diversity that you're looking for could probably be found if you're working with smaller private practices around the state.
Yes. So I'm going to tie both of those questions together because I'm going to bring up another really important point. We start from a foundation of understanding resilience, that resilience doesn't have to come through a doctor's office. It doesn't have to come through a counseling service, although I'm sure your counseling service is amazing. It might come through a church. It might come through a soccer club. It might come through a music group. All of that participation is what we're looking for. And so to both of your points, it's not intended to remain an institutional coalition. It is intended to become a groundswell of, and it sounds silly to say this, every time I say it, my boss looks at me, he says, "Don't say that." The best case scenario is when SOAR actually leaves my hands and is in your hands. Because when it moves out of my control, that means it's actually doing what it's supposed to do. People are trusting it, and they're seeing it as an agenda and an avenue to move towards wellness. That is, to me, the pathway, and I need advice, support, and help to move it to that place. So it's not just a research study, it actually becomes an initiative, a coalition, a driving force to change the way we think about mental health and addiction in our state. All right. All right, thank you.
Good morning, everybody. My name is Linda Jakes. I am the Executive Director of Concord Counseling Services and also the current chair of the Provider Leadership Association. And probably giving you just a quick background, Provider Leadership Association, the PLA, is a collective of providers that are funded by Adam, and we get together on a very regular basis to kind of make sure that we are providing services as a collective, as a system of care with quality and being able to help each other out. So big piece of what we do is to make sure we get to provide things the way they should be. But today, my job is kind of fun. I get to give out money. Each year, we provide a scholarship to 2 individuals that are students within our system of care. And this year, we have 2. I believe we only have 1 with us. Lena is with us. There's, come on up. Yay. So Lena is currently a student with Ohio Guidestone, and I'm going to read real quick about you, just a little teeny bit. She is a master's level intern with Capella University. She is a positive self-starter whose excitement for our work is contagious. In her work with clients, she has demonstrated an ability to form empathetic relationships through which clients are able to work toward their goals. So, well done, my friend. The other individual is Joshua Gass. He is with Southeast. What Bill Lee said about Joshua is the knowledge Josh has attained during his graduate. You're Josh.
I'm here.
What's up, man? Good job. I didn't know you were here. Excellent. Okay. The knowledge Josh has attained during his graduate social work program at The Ohio State University has elevated his ability to support those struggling with their recovery. He has a unique ability to engage with individuals whose symptoms often make it difficult for them to stay connected with formal treatment and supportive services. And his clients love him. Big L-O-V-E. So, congratulations to both of you. Scholarship, and we need to get a picture.
You have to get a picture?
We get to have a picture. Welcome back, Erica.
Okay.
She's coming up on the stage with you. Good job. Glad you're here. Congratulations.
Thank you.
I love Josh's shirt. I got to get one of those. So, as we are transitioning to the annual awards portion of this program, I want to take a point of privilege and share a special recognition. Adam H. Franklin County's work would not be possible without deep, meaningful partnerships across our community with leaders from all sectors, so many of whom are here this morning. Today, I am pleased to recognize one of those partners with a special award, Mr. Jeff Klingler, President and CEO of the Central Ohio Hospital Council. And we could recognize Jeff for many things, but today I'm going to recognize him for his commitment to the crisis care continuum across our county. Jeff is invested, period, full stop. He's invested. He shows up every day, committed to our community. He helps us to seek innovative ways to address healthcare issues, especially for those with mental health and addiction-related disorders. Although Jeff and I's relationship goes way back in thinking about maternal health and infant health across our community. Through his work representing the adult-serving hospitals here in Central Ohio, he convenes stakeholders to solve health and wellness problems such as the opiate epidemic and addiction. He's been engaged with the Franklin County Bed Board since it was established in 2009 to assist with access to inpatient care for those in psychiatric emergency. And when the Bed Board data showed an escalation of individuals in mental health crisis filling up our hospital emergency room, Jeff provided leadership for the Psychiatric Crisis and Emergency System Task Force, which ultimately led the recommendation of what will become the Franklin County Crisis Care Center. He's been a partner with Adam H. every step of the way for most of the past decade as our community came together to develop our center. He also helped to secure $8 million of capital campaign donations from the adult serving hospitals Ohio Health, Mount Carmel, and OSU Wexner Medical. He serves as chair for our Crisis Care Community Advisory Council. He's actually co-chair. And a group comprised of individuals with lived experiences and longstanding community partners providing guidance on aspects of our continuum. He's also partnering with Sue Valillo and our team to broaden the use of the bedboard platform to streamline access to transitional housing for those who have been discharged from an inpatient setting. Jeff, not only are we grateful for your leadership and partnership and ongoing collaboration, I'm grateful for our friendship. Thank you.
Thank you very much. Thank you very much. Thank you very much. It's the very, very kind words, Erica. I really appreciate it. This, recognition, actually, it means a lot. And I think that it's not a recognition of me. It's not really a recognition of the Central Ohio Hospital Council. I really view this recognition as some really great partnership and some great collaboration. We talk in this community a lot about the Columbus Way. If you've heard that term before, it's about how do we get things done, right? It's about the private sector, the public sector coming together to achieve a common goal. And I just don't know if there's any better example of the Columbus Way than the work we've done over the past several years to develop not only the plans for the crisis center, but really the entire continuum. And I think back at some of those pictures that you see up there about the PCES task force, which I know so many of those folks in this room were part of that work. We had 30 organizations, more than 30 organizations coming together on a monthly basis to talk about this work. And it took a couple of years, right? And after a couple of years, typically on these types of initiatives, you see, participation start to dwindle. But not this one. The room didn't get smaller, the room grew. I think that, folks were very excited about that we were having this community discussion about how we can work together to improve the psychiatric crisis system here in Central Ohio. And so this, this recognition is very humbling. I was very happy to be a part of that. And more importantly, I just really appreciate the partnership, the collaboration, not only among the AdamH staff, the AdamH board, but from so many folks in this room. Erica, you share some very sobering data. We have more work to do. So again, thank you. Thank you very much.
Good morning. My name is Tamara Porter, and I'm with Concord Counseling Services. As a past recipient of the Kevin Dixon Champion of Diversity Award, I'm honored to be able to help announce the 2024 AdamH Awards for Outstanding Contributions. We are pleased to have Kevin Dixon in attendance today. Kevin, would you please stand and be recognized if you are here? All right. In spirit, there you go. These annual awards represent a snapshot of the extraordinary dedication of our professionals who work across the entire AdamH network. This year, we're going to be presenting 5 awards. We are now going to premiere this year's video highlighting the 5 award recipients, and then following that, we're going to ask that the recipients come to the stage to receive their award.
The 2024 AdamH Awards honor the individuals and organizations in the behavioral health system who go above and beyond in their work, their volunteerism, and their advocacy to support the Franklin County community. Our first award, named in honor of the late Barry Mastering, recognizes an individual who promotes collaboration among organizations and inspires others to work together to improve the lives of people affected by mental illness and addiction. The 2024 Barry Mastering Award goes to Jody Sanders, Ohio Guidestone's court liaison. Jody is an exemplary advocate for her clients, coordinating with outside agencies and providing every resource available to best serve those on the specialized dockets. She uses a variety of public and private funding sources, as well as linkages and referrals, to help bring individuals out of their crisis and back on their feet so they can begin working on their mental health and substance use disorder needs. Jody provides clients with support and compassion that builds trust. She maintains that trust by always following through with what she's told them. Jody's hard work and dedication to her clients is valued by her colleagues at Ohio Guidestone, and they are grateful to have her as part of their team. Thank you and congratulations, Jody.
I would like to thank my supervisors at Ohio Guidestone for nominating me and always being there to give me support and guidance. I would like to thank all of my coworkers for being team players. I would like to thank Franklin County Specialty Dockets, MAVS, Recovery Court, Heart, Ties, and Family Recovery Court for letting me be a part of their team. I would like to thank my family, especially my children, Donovan, Alyssa, and Chaz, for being patient when I sometimes bring work home. I appreciate all my clients giving me the chance to make their lives the best it can be. And finally, I would like to thank the Adam H. Board for this award. It feels very rewarding to see my work appreciated.
Our next award honors the work that Dr. Kevin Dixon championed during his 34 years of service to Adam H. and recognizes the advancement of diversity, equity, and inclusion in the behavioral health space. The 2024 Kevin Dixon Champion of Diversity Award goes to Danielle Smith, Executive Director of the National Association of Social Workers, Ohio Chapter. For the last 17 years, Danielle has led initiatives to advance and promote BIPOC and LGBTQ rights, as well as overall anti-oppression work. She worked to connect the National Association of Social Workers Ohio chapter to the National Association of Black Social Workers Columbus. This resulted in partnered solutions to discriminatory social work practices and trainings provided to social workers on how to navigate racism in practice. After a teenager in Cincinnati died by suicide in 2014, and her suicide note revealed she was a victim of conversion therapy, Danielle led statewide efforts to ban this practice. She pursued action within state licensing boards, as well as led a city-level strategy to banning conversion therapy. Danielle's commitment to social workers helps practitioners impact the lives of diverse residents in Franklin County and across the state. Thank you and congratulations, Danielle.
My life, my well-being, the quality of my future are deeply connected to the strength of our community. Our community is strong when it's diverse, so this award recognizing my part in amplifying the needs of our community is so special. I want to thank Stephanie Starks for nominating me and always being so supportive. Our liberation is tied to one another's. None of us are truly free unless all of us are. It is our shared moral responsibility to care for each other. Together we are stronger. Together we can overcome any challenge that lies ahead, but only if we create a space where everyone is valued and everyone belongs.
This next award, in honor of the late Randall M. Dana, recognizes a demonstrated track record of excellence in the field of clinical and client care for individuals experiencing addiction. This year's recipient of the Randall M. Dana Award of Excellence is Robert Urisco, Program Director at House of Hope for Recovery. With over 17 years of experience in substance use treatment, Robert has served in multiple roles, predominantly in direct client care. He is a dedicated and adept clinician with an extraordinary talent for connecting with and motivating the clients he serves. Throughout his career, Robert has served as the primary counselor for more than 1,000 clients. He also led the creation of the Short-Term Stabilization Program, now a key component of the agency's range of services. Recently, Robert took on the directorship of House of Hope's Short-Term Stabilization and Outpatient Services programs. In addition to his extraordinary work with clients, Robert devotes a significant amount of time to supporting individuals who are beginning their careers in the behavioral health field. He never hesitates to use his time and energy to offer supervision, consultation, or encouraging words to those he works with. Thank you, and congratulations, Robert.
I'm deeply honored to receive this recognition. First of all, I want to thank my incredible parents who exemplify what it means to serve, among others. I feel incredibly blessed to call them my parents. I also want to express my gratitude to the incredible team at House of Hope. The work we do together, striving to uplift those struggling with addiction, is a testament to the power of community compulsion and resilience. This award reflects our collective effort and a positive impact we strive to make every day. Thank you.
The Art Lynn Community Advocate Award honors an individual who has demonstrated a long-term commitment to improve the quality of life for people in Franklin County. This year's honoree is Jennifer Johnson, Intensive Outpatient Coordinator at Maryhaven. Jennifer's journey at Maryhaven began as a client, and she has dedicated the last 20-plus years to giving back the knowledge and hope that she has gained and others have instilled in her. Jennifer found sobriety at age 54 and has become one of Maryhaven's longest-serving employees. Jennifer proudly joined the Maryhaven Care Team as an assistant case manager in 2000. She has since held several positions in the organization and currently leads group therapy sessions, sometimes multiple times a day, in the intensive outpatient program. She has a natural ability to build relationships and cultivate change. Jennifer approaches people without judgment, allowing them to be exactly who they are, and uses her skills of meeting people where they are when they present for services. Thank you and congratulations, Jennifer.
I stand here today representing those who have come before me, those with us now, and those who will come in the future. Over 20 years ago, I walked into Maryhaven as a broken woman and was welcomed with open arms. I received life-changing support without ever getting a bill. That kind of generosity is rare. Thank you to everyone here today for supporting the work we do at Maryhaven. Your trust allows us to serve our clients and staff and community at the forefront. To our CEO, Oyama Garrison, and his leadership team, thank you for fostering an inclusive, supportive environment and launching programs that reflect your commitment to our community and staff. To my colleagues, especially the outpatient staff, it is a privilege to work alongside such dedicated individuals who always put the client first. And to our clients, thank you for your trust and courage. You inspire us every day. If there's one thing I hope you take from this, it is that I am deeply grateful to all of you. Thank you.
Our final award is the Extraordinary Mile Award, honoring the extraordinary efforts in addressing the mental health and addiction recovery needs of Franklin County residents. This year, we are pleased to recognize Wesley Moore, Transportation Coordinator at St. Vincent Family Services. Wesley supports the transportation needs of children attending St. Vincent Prep Academy, a day treatment program serving youth ages 3 through 12 with significant social, emotional, and behavioral health needs. Wesley goes above and beyond by assisting parents with enrolling their students on a transportation route, helping to resolve transportation conflicts, and keeping the lines of communication open between parents and the transportation providers. Wesley helped make trainings available to drivers to ensure a better understanding of the behaviors they may encounter from students and to provide them with trauma-informed methods for responding. Wesley is a true team player who steps up whenever he can to help clients and colleagues alike. At the end of each school year, Wesley voluntarily coordinates and prepares a fish fry to celebrate with all. According to his nominator, Wesley has an every job is my job mentality, and his positive attitude greatly contributes to a healthy workplace culture. Thank you and congratulations, Wesley.
I would like to thank St. Vincent Family Services and our executive leadership team of Susan, Paul, Regina, and Angela for nominating me for this award. I would also like to thank the Adam H. Board for bestowing this award upon me. I also would like to thank the parents and guardians and the individuals and the students who allow me to serve them on a daily basis. It is my honor and pleasure to be able to assist and serve the community. Last but not least, I would like to thank my family, my wife in particular, for inspiring me to be of service to my community. Thank you.
Please join me in giving a round of applause to the award winners as they come to the stage to accept their rewards.
Congratulations again to our very astute award winners. Good morning. This might be the last formal good morning of anyone on the stage, but my name is Dr. Kay, and I serve as the Vice President for Advocacy and Engagement here at the Alcohol Mental Health Board of Franklin County. And I'm sorry, I'm so short. Y'all have been so tall before me. I've got to make an adjustment here. I want to say a couple of things before I kind of close this out. And that is, one, to call out this sheet of paper that everybody has at their table setting announcing the series finale for the Adam H. OSU Cultural Responsiveness Training Series. The first day of November 13th is online. If you haven't registered yet, please do. We fill up quickly, and the second day is in person. This particular effort in November is a focus on our immigrant, refugee, and asylum-seeking individuals, and so that speaks to some of the diversity that Dr. Legenbecker was talking about earlier. And this thing about resilience, I'm so glad I get to close this out, because a couple years ago, I was preparing for a keynote, and it led me down this road of social determinants of health, which of course led me down the road of resilience. And there's a definition of resilience that I found that I actually did not like. And it said that that resilience is a person's ability to recover quickly. And I was like, why can't we just recover though? You know, like just in our own time. So I believe that resilience is, in fact, our ability to recover from all of those different tenets that are impacting our lives. And so I certainly believe that it takes time to recover. And I really appreciate what you said regarding that we are not destined to be what tomorrow was. Today can be better than yesterday was. Did everybody hear that? That was very profound. And so to me, I also translated that literally to understanding that the struggle is real, but so is resilience for all of us. So what are the new pathways, that you will take with you today? Perhaps you'll sign up to participate in this study, or possibly you'll reach out to Dr. Legenbecker and his team to be a part of the advisory council that needs some more diversity. So I hope that language fell on receptive ears. So as we leave the meeting today, I just want us to kind of just take away a lot of what we heard. Hopefully a lot of what was shared, you resonated with at least one thing, and you can consider what that one thing may look like for you as an individual or for you as your family, because we all have a responsibility to those who not only manage for today's behavioral health needs, but also to lay the groundwork for a better future for all beyond today into tomorrow. Thank you for your time. I hope you have a wonderful trip to your next location. I'm sure we're all running off to something, but thank you for joining us again this year for our annual meeting.